From Denver 7, this is 7 News.
March is Colorectal Cancer Awareness Month, and it's a good reminder to get your screening and see where you are, actually where we are now with treatment and prevention. A lot of new stuff and research going on. Joining us this morning is Dr. Matt Reveille. Did I get that right?
You got that right.
From Rocky Mountain Gastroenterology Associates. Thank you so much for being here. We appreciate it.
Thanks for having us.
So who should be screened here?
Our current guidelines suggest that at age 50, anyone should get colorectal cancer screening. There are subgroups of patients at risk that should get screening earlier. Patients who have a family member with colon cancer probably should get screening no later than 10 years earlier than the family member at their age of occurrence. So we're seeing that colon cancer screening may be moving into the 40s for some groups. African Americans perhaps should get screened at 45, not 50. But the guideline at this point is 50.
Wow. And you know, I didn't realize this, but colorectal cancer is actually the second leading cause of cancer here in the United States. There's a lot of options out there for screening, including virtual colonoscopy. Can you tell us about that, and also what's new in screening maybe for the future?
You know, the standard has always been to either measure the stool for occult blood or what we do is colonoscopy. But the advent of high-resolution CAT scanning technology has allowed patients to get their colon looked at using X-ray as a non-invasive measure. Obviously, if you see polyps, then you need to have a standard colonoscopy to remove them. But it's a new tool. The most exciting thing are some of the genetic testings where we take a stool specimen and actually look for the DNA that might be a sign that there's colon cancer cells already in the colon. Much more palatable.
Yeah, I was going to say, a lot of people still cringe anyway, the thought of it, but this is something that possibly could be in the future, right?
It could be in the future.
Okay, so that's a good news here. What about symptoms that we can be on the lookout for?
Well, we'd prefer not to have symptoms, but symptoms that might be what we call the alarm symptoms, get screened, get it checked out, seeing blood in the stool, stool caliber has changed, unexplained weight loss, low blood count, anemia. Unexplained anemia is often a sign that there may be a colon cancer lurking in that person's digestive system.
For those who are not insured, we often talk about that, you know, you need to get screened. And today there are, you guys are giving free screenings, correct, for those who are not insured?
Yes, under the Colon Cancer Screening Program through the University of Colorado, participating GI groups around town this month are going to be offering full colonoscopy services at no charge to the patient, including pathology, sedation, etc. Today just happens to be that Rocky Mountain GI is going to kick this off at our Lakewood Center.
Okay, and for all the information, by the way, you can go to our website, thedenverchannel.com. We should have a list of all the participating groups, correct?
They should be
on there. All right, thank you so much, Dr. Reveille, for being here today. We appreciate it.
Thanks for having me.
Very important reminder to get screened if you need to.